Good afternoon to everyone and welcome to today's session. One of the common feelings in the mind with just few more days for the AIIMS PG medical entrance, what is the examiner going to ask me? How am I going to reproduce the answers and perform great in the upcoming AIIMS and PGI? So, good to see all of you. Can you please punch whether the voice is loud and clear for all of you, doctor? Jeeva, Dhanalakshmi, Sushmita Khannan, Atul Lakshman, Ritesh Raja, Ram Sundaram, and many more. Can you please punch whether the voice is loud and clear for all of you, doctor? Yes. Yeah, very good. So let's make the great beginning. 178 most common based questions in the NEET PG, FMGE, AIIMS, PGI based on the past 15 years of question papers. Let us crack. Very good to see almost 36 online students. Please inform your friends to join these sessions. So keep punching your answers also actively. I'll try to run through a very cursorial, exam-oriented, crispy, yummy session where 176 most common based MCQs in the NEET PG and FMG, let us take up for the discussion. So, doctor, yes. 2 minutes, doctor. I got disconnected and just reconnecting. Please be online. Kabhi kabhi technology is always baffles me. Yeah. Yes. Sorry for a short interruption. Let's take up 176 most common base questions in the past 15 years of AIIMS, All India, PGI, JIPMA in the general medicine. The most common cause of the acute card pulmonale. Keep punching in the chat window your answers, what you feel, and any 1-2 comments about that particular answer. That's how we will make it more a interactive session. The most common cause of acute card pulmonale undoubtedly is pulmonary thromboembolism is what you need to basically remember. I'll just take one pen color. Yeah, blue. What is the most common cause of acute right ventricular failure? You all know, doctor, very well that the right ventricle pulmonary artery is opening. Right ventricle is pumping into pulmonary artery. That's the reason any massive pulmonary embolism will put acute pressure on the right ventricle that lead to the development of the right ventricular failure. What are the clinical signs of right ventricular failure, doctor? Elevated jugular venous pressure, presence of the pedal edema, presence of ascites, pleural effusion, etc., etc. They're all the signs of the right ventricular failure. The most underlying cause is the massive pulmonary embolism is what you need to remember. What are the most common site of intracranial hemorrhage and hypertensive hemorrhage? Any given day it is the basal ganglia. So there is a cerebellum, basal ganglia, thalamus. There are all the various classical sites where hemorrhagic stroke happens, but most common is basal ganglia. A chronic alcoholic develops palpitation suddenly after an alcoholic binge. His pulse is irregularly irregular. What is the type of arrhythmia which is most commonly associated with the alcoholic binge? In case of alcoholics is my question to all of you. Atrial flutter is the most common, is what you need to understand. What is the most common type of maturity onset diabetes among young? The genetic mutation. Once more, the favorite, most common of the examiner. Hepatocyte nuclear factor 1 is the one which is the most common type of mutation. What is Edison? Edison is adrenal insufficiency. Most commonly throughout the West. It is the autoimmunity most common. But in India, हम इस देश के वासी हैं जिस देश में टीबी बहती है. So TB is the most common underlying cause is what you need to remember. Now with regard to chronic myeloid leukemia in case of children, we use the protein tyrosine kinase inhibitors, which are the ones which are used in the treatment, the most common drug of choice. What is the most common primary lymphoma of the spleen is the favorite question. A small lymphocytic lymphoma. Small lymphocytic lymphoma. Always, lymphoma involves typically the WBC lineage, lymphocytes. So based upon the morphology of the cells, there is a classification of the lymphoma, but small lymphocytic lymphoma is the most common primary lymphoma involving the spleen. The most common subtype of non-Hodgkin's lymphoma. Examiner is going to haunt you in the tomorrow's exam. What is your emphatic answer, doctor? Diffuse large B-cell lymphoma is considered to be the most common subtype of non-Hodgkin's lymphoma. In beta thalassemia, the most common gene mutation is the examiner's favorite question. It is the intron 1, which is affected, is the most common gene mutation. So you should become experts in 176 most commons invariably asked in the NEET PG exam. FMGE, AIIMS, PGI, JIPMA. We have only 5 exams left over in this entire country, right? So any exam you go, I'm telling you, doctor, this is the Bible. This is the Bible. There are totally around 20,000 MCQs covering all the 19 subjects based on AIIMS, PGI, JIPMA, DNB, and All India NEET PG, and FMGE. After we remove the common questions, unique questions are 20,000. So what we have done is we created something called Q Scanner, which is available for you, and organized these 20,000 questions topic-wise classified into 200 section tests containing 100 MCQs each. 100 MCQs, 200 section tests. They're available on the online mbbs.com, right? So take every opportunity to subscribe to the video library, subscribe to the Q Scanner, take tests every day, 100 MCQs you take. It will tell you, hey man, you answered X number of rights in this topic, and in this topic you are going wrong. You need to improve. It will immediately give you a complete report, Q Scanner. Similarly, we have a 65 full-scale NEET PG mock test. April 1st to November 30. Every Sunday, a test, online test, followed by discussion on Monday. From December 1st to December 31st, every day test, followed by discussion in the afternoon. So once you solve this 65 full-scale grand test and 20,000 MCQs like section tests with a topic-wise analysis of your areas of weakness and strength, you don't need anything else in this world to crack a top rank in the NEET PG, FMGE, or any damn exam in the world that you are preparing, doctor. So that is my promise to all of you. That is my promise to all of you. Yes. Now, doctor, the most common late central nervous system complication of the HIV, what is that? It is dementia. AIDS dementia is the defining illness of the AIDS. What is the single most common cause of pyrexia of unknown origin in India? Mycobacterium tuberculosis. which is the gram-positive organism, which is the most common cause of the urinary tract infection among sexually active women. That is an important clue. Staphylococcus saprophyticus. Subdural hematomas. What is the main reason? Typically, subdural hematomas are all venous bleeds. Extradural hematomas, they're all arterial bleeds. Subdural are all venous bleeds. Elderly person with a shrunken brain. So there are some cortical bridging veins between the calvarium and that shrunken brain. Veins, cortical bridging veins. If you go and meet your grandpa and say, hey, grandpa, I got a top rank in NEET PG. You are jerking his cortical bridging veins. They can undergo rupture and grandpa can go into subdural hematoma. Be very sure. So, the most common clinical presentation of juvenile myoclonic epilepsy. Juvenile myoclonic epilepsy, as the name itself says, presents with myoclonus. They are called salam jerks. Salam spells. Suddenly patient who is sitting on the dining table will lose the tone and go into salam spell. It is called as. They say, "Ab salam karte hain." Now, the most common cause of subarachnoid hemorrhage. It is the aneurysm in the anterior communicating artery, the most common location. The most common cause of sporadic viral encephalitis is herpes simplex encephalitis. So 176 most commons, you are going to become champions. हम बहुत खुश हैं. 53 online students are having an opportunity to be part of this game. Yes. Ritu Raj is saying, sir, answer is already there. Still you keep punching your answers. It is like a second reinforcement for your answer. अगर कोई पॉइंट आपको याद में आ गए तो वो भी टाइप पंच करना ताकि it will be like a combined preparation every day. And let me tell you, doctor, I am roping in a dream team of 150 medical teachers. Handpicked, the one who is being well tested that he's a great speaker, great knowledgeable, motivating teacher. I'm picking up 150 medical teachers. They all promised to live broadcast freely into the YouTube channel of onlinembbs.com. So please, almost all every day about 10 to 12 hours, you have some other teacher presenting the revision online sessions on the YouTube. You can enjoy that, and you can go back and subscribe to that particular teacher's 20 hours, 30 hours video library, right? So we started a new education startup called INCUS. Please visit incus.online is the website. So there we are roping in the dream team of some of the best teachers in the world, 150 medical teachers. And each of them is going to freely broadcast into the YouTube channel of Online MBBS. After that, of course, the video will be removed from the YouTube and then archived into the course of the teacher, to which you need to pay and join. But we want to give you that variety of teachers globally who love to give handwritten notes, special notes, point-wise notes, and also a wonderful review session interactively to you through this YouTube channel. Now, most common site of subependymal astrocytoma is the foramen of Munro. What is the most common childhood CNS tumor that metastasizes outside the brain? Medulloblastoma. Medulloblastoma. Medulloblastoma बोलते ही आपको pediatrics याद आना चाहिए because it is a typical childhood CNS tumor. What is the most common tumor associated with type 1 neurofibromatosis? It is the optic nerve glioma, which is considered to be the most common tumor. Optic nerve glioma. What is the most common organism leading to lobar pneumonia? Streptococcus pneumoniae. You know pneumonia is of lobar pneumonia, bronchopneumonia, and interstitial pneumonia. All viral pneumonias are all interstitial. And for the lobar pneumonia, the most common cause is Streptococcus pneumoniae is what you need to basically remember. With regard to the aspiration pneumonia, you should remember posterior segment of the right upper lobe, not lower lobe, right upper lobe is the most commonly affected in the recumbent position. Please don't forget this point. And aspiration is responsible for 5 to 15% of the community-acquired pneumonias. And for the aspiration pneumonia to occur, how much quantity should be aspirated? 20 to 30 ml of the content with a pH less than 5. Typically, the gastric contents which are acidic are the ones that lead to the development of aspiration pneumonia. What is the most common cause of the mononeuritis multiplex in India? What is mononeuritis multiplex? Doctor, my radial nerve in this arm, my ulnar nerve in this arm, and here somewhere my tibial nerve in the leg. Multiple anatomical locations. You can't explain it with one single compressive lesion. That is called mononeuritis multiplex. Typically, it occurs whenever there is any vasculitic phenomena, and it is the Hansen's disease, the most common cause of the mononeuritis multiplex. Which CNS tumor is most commonly associated with HIV? Lymphoma. So, what is the close differential diagnosis for a space-occupying lesion in the brain, doctor? It can be lymphoma, or it can be, what else it can be? It can be toxoplasma. Toxoplasma versus lymphoma. So for proving that it is lymphoma, you need to do brain biopsy, which is a very morbid procedure. So you prefer to give a 6 weeks trial with pyrimethamine. If it were to be toxoplasma, it will resolve. It will resolve. But if it were to be lymphoma, it won't resolve. Then you need to do brain biopsy. Which HIV subtype is most common in India? It is the C subtype is most common. Hemiplegia. Where do you see hemiplegia? All middle cerebral artery lesions lead to hemiplegia. And anterior cerebral artery lesions will lead to contralateral lower limb monoparesis. They lead to. So that means if your right anterocerebral artery is affected, left lower limb will go into weakness, and only left lower limb, nowhere else. Contralateral lower limb monoparesis is the presentation of anterior cerebral artery occlusion. What is the most common false neurological sign? It is a diplopia. So typically you have the calvarium, doctor, and you are having the midbrain, pons, medulla. So the temporal lobe, whenever it is herniating because of a raised intracranial tension, it will push the midbrain to opposite side. and that can lead to a lesion of the oculomotor on the opposite side. So that is the reason you may think that there is a lesion on this side, I mean to say the left side, but in fact the lesion was there on the right side, which is pushing it to the opposite side. Hence called false localizing neurological sign is what you need to remember. Good to see Nihar Nayak, Akshay, Ram Sundaram, Nikita Chowdhury, and many more. Thank you, Nikita, for your generous compliment. Sir, your sessions were really helpful in NEET PG 2020 exam. Thank you so much. So, I will also appreciate if you can give a call to the helpline 9000868 and can be able to give a video testimonial how it helped the exam. That would be a small kind gesture that encourages the teacher and the team to continue to serve the students. And in fact, we also as teachers enjoy spending time with all your entrance going guys. So doctor, the most common cause of the intraventricular bleed inside the ventricle, typically any parenchymal bleed within the brain, parenchymal tube bleed sometimes can have an extension into the ventricle. The most common cause of embolic stroke, whenever embolic stroke is there, typically embolic strokes all present like a hemorrhagic strokes. So that is the reason whenever patient is having hemorrhagic stroke, it is a common tendency to do 2D echo. So that you will be able to see a intracardiac neural thrombi that undergo embolism to the brain leading to the hemorrhagic stroke is what you need to remember. What is the most common cause of sudden death in myocardial infarction? Ventricular fibrillation. Can online students can punch whether the font size is okay, that you are able to appreciate the question on the screen? Now, angina pectoris is the most common presentation of aortic stenosis. Why? Typically, what's happening in aortic stenosis? From the left ventricle, aorta is arising. Aortic valve is tight and stenotic. From the root of aorta arise the coronaries that supply these are the coronaries that supply the myocardium. So any stenosis of the aortic valve will decrease the blood flow at the root of the aorta. And can the online students can punch whether the font is okay for you, the font of the letters, that you are able to appreciate the font. So coronaries decrease. There is a decreased blood flow in the coronaries if there is aortic stenosis and a decreased flow at the root of the aorta. That's the reason angina is the presenting feature. If there is a decreased flow into the aorta, when the blood flow to the aorta is decreased, that typically lead to decreased flow to the brain. That's the reason syncope is the classical feature. Syncope is the classical feature of bigger is always better. Okay, next time when I present, I'll try to see that the font is made a little more bigger. Yeah, sorry for that. This is a new format of live broadcast that we have started. We took a new platform called StreamYard. So that's the reason. Now, doctor, angina, syncope, dyspnea. Obviously, when the blood is unable to move from the left ventricle into the aorta, there is an increased pressure in the left ventricle. That will reflect on the left atrium. And what is draining into left atrium? Pulmonary veins are draining. And that increases the back pressure on the pulmonary veins. That leads to pulmonary edema, and that leads to development of dyspnea. So all the back pressure effects of the aortic stenosis typically will lead to classical. What are the three classical cardinal clinical features of the aortic stenosis, doctor? Angina, syncope, and dyspnea. But you need to add one adjective to that. What is that adjective? It is an exertional angina. Only when the person gets up and gets exerted, then only aortic stenosis, which is otherwise asymptomatic, becomes symptomatic with angina. Exertional angina, exertional syncope, exertional dyspnea. These are the cardinal clinical manifestations of angina pectoris. Out of that angina is because of the coronary insufficiency. The most common complication of cardiac catheterization क्या होता है? Typically, cardiac catheterization can lead to development of bleeding, vascular bleeding. Of course, today, getting a coronary angiogram is like catching a flight and traveling from Mumbai to Delhi. उतना simple है. फिर भी vascular bleeding is a complication. Most common association with atherosclerosis, smoking and atherosclerosis go together. Most common form of diabetic neuropathy होता है distal symmetric sensory and motor neuropathy in a glove and stocking distribution. Distal symmetric sensory and motor neuropathy. If you have done this question wrong, you should take every opportunity to go back and review the topic neuropathy in the online mbbs.com video library, doctor. Most common inherited peripheral neuropathy होता है Charcot-Marie-Tooth type 1. Charcot-Marie-Tooth syndrome is the most common inherited neuropathy. Most common cause of pulmonary abscess in cystic fibrosis. It is the pseudomonas or eugenosa that lead to pulmonary abscess. Acute endocarditis with abscess, most commonly. Always remember, whenever examiner asks a question on osteomyelitis, whenever examiner asks a question on endocarditis, what will you remember? Staphylococcus aureus is something that you should not forget. Okay? If Staphylococcus is in the option, Staphylococcus is the answer. Utna simple hai. Most common cause of infective endocarditis, once more, Staphylococcus aureus. Most common renal condition in HIV patient, FSGS. Doctor, take it as my word. Without a question on glomerulonephritis, either in pathology or medicine. Without a question on nephron physiology, what does ascending limb of loop of Henle will do? What will descending limb of loop of Henle will do? Which is the diluting segment, which is the concentrating segment. Without a question on nephron physiology, है तो मेरा नाम मुरली भरद्वाज नहीं है. उतना गारंटी के साथ आपको बोल रहा हूं, मेरे प्यारे भारतवासियों, आप सब पढ़ना है. ग्लोमेरुलोनेफ्राइटिस नहीं पढ़ के अगर आप एग्जाम को जा रहे तो you are not going to exam at all. Will you promise me? Yes. The job of a teacher is not always to teach. The job of the teacher is to shout, plead, motivate you to read, to revise what is most commonly asked and expected by the examiner. Okay, so that is the reason, doctor, please don't forget, every day you have a session, not just one session, a good number of times, many live broadcasted sessions on youtube.com/online MBBS channel, your favorite channel. Please don't forget. And also subscribe to our online MBBS.com video library for a throwaway price, whatever you can afford. You get all these PowerPoints, all these videos, and full-scale grand tests, discussions, and 20,000 MCQ Q scanner for you to take the test and get your assessment. Everything is available on the online MBBS.com at the most affordable price. What you can pay, you will get it. Not necessarily what we ask you, right? So, most common renal condition in HIV patient, focal segmental glomerulosclerosis. Now, what is the most common presentation if there is a sick euthyroid syndrome? Whenever you get an acute illness, there's an alteration in the level of the thyroxine binding globulin, and that will affect the thyroid function test, which is called sick euthyroid syndrome. Low T3 levels with a normal T4, normal TSH is basically the most common presentation. The most common cause of acute tubular necrosis. Whenever a person goes into a hypovolemic shock, that is the most common cause when there is a decreased renal perfusion that leads to development of acute tubular necrosis. What is the most common cause of hypertension? Essential hypertension without secondary causes. Anybody below the age of 30 years, anybody above the age of 50 years, you should think of secondary. Below the age of 30 years, what are the common causes of hypertension, secondary hypertension? Fibromuscular dysplasia, Takayasu arteritis in a young Asian female, sweet looking, presenting with hypertension, with pulseless, one of the limbs, radial artery, if you palpate, pulseless disease it is called. They are the underlying causes. Above 50 years, above 50 we are a pot of fat. Atherosclerosis get accumulated at various locations, including renal artery, leading to development of renal artery stenosis. Secondary to the atherosclerosis is the most common cause of the secondary hypertension after 50 years, is what you need to remember. So what is the most common cause of all for the secondary hypertension? It is the renal parenchymal disease, which is the most common cause. What is the most common cause of refractory hypertension? Refractory hypertension. Actually, these are all the causes of refractory hypertension. Different studies give different numbers. I don't want to commit on option B. You just recheck this question. So what is the most common cause of the renal artery stenosis above the age of 50? Just before we said that, atherosclerosis is the most common. Mononeuritis multiplex, Hansen's disease. Guillain-Barré most commonly is associated with Campylobacter jejuni. So let me tell you, doctor, every subject, 19 subjects we have now for the tomorrow's NEET PG exam, FMGE exam, AIIMS exam. Every subject has around 150 to 170, 150 to 200 most commons. पूरा 19 subjects मिलाए तो there are about 3000 most commons. हम खेलते 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 रिविजन करेंगे. Please be tuned to onlinembbs.com video library. So, Campylobacter jejuni, Guillain-Barré, most common primary site of congenital TB, liver. You don't expect, but liver. Liver is the answer. Primary TB most commonly involves lung. Most common primary site, suppose if they ask, most common primary site, whether it is congenital TB or otherwise TB, lungs is the most common. But oh, here lungs is also given, right? All pediatrics books say liver, but just recheck lungs and liver, right? Now, what are the most common spread of congenital TB? Congenital TB or adult TB, both of them most common is hematogenous is the most common spread. Most common site of ulcerative colitis is rectum. Rectum is what you should understand. What is the most common cause of death if there is a primary amyloidosis? You should remember primary amyloidosis versus systemic amyloidosis. The causes differ. So cardiac involvement is more often a feature in case of primary amyloidosis. What is the most common cause of dilated cardiomyopathy? भारत में देवदास मिलता है आपको, पारू के लिए पीके पीके मर गया. कैसे मर गया? अल्कोहलिक डायलेटेड कार्डियोमायोपैथी से. Most common lymph node which is involved in Hodgkin's lymphoma is cervical lymph node. Hemangioblastoma associated with von Hippel-Lindau's. Where do you find hemangioblastomas? Cerebellar hemangioblastomas are very common in von Hippel-Lindau. Intracranial aneurysm rupture हो गया, symptomatic बन गया. What is the most common presentation? It presents like a subarachnoid hemorrhage, as all of you know very well. What is the most common site of biliary aneurysm rupture? It is not posterior, it is anterior. Correct answer is B. Anterior circulation of the brain at the anterior communicating artery. Which nerve is commonly involved in sarcoidosis, Dr. Facial nerve is most common. Which organ is most commonly involved in sarcoidosis? Lung is most commonly involved in bilateral hilar lymphadenopathy. They are called potato lymph nodes in sarcoidosis. How is the skin involved in sarcoidosis? Lupus pernio is the lesion in which are pink lesions, which are nodular in sarcoidosis. Holt-Oram syndrome. The most common cardiac presentation is with ASD, as all of you know. And Bell's palsy is the most common lower motor neuron cause. Idiopathic facial nerve palsy, Bell's palsy is the most common facial nerve palsy. Whenever there is a cranial aneurysm, typically posterior communicating artery. What is it connecting, doctor? You have a middle cerebral artery arising from carotid, and you have a posterior cerebral artery. Between the two, you have the posterior communicating artery. If there is an aneurysm, it is very close to the midbrain. From the midbrain comes out the oculomotor nerve, which get compressed by this aneurysm. That's the reason oculomotor palsy is the cranial nerve most commonly involved in cranial aneurysm is what you have to remember. मधुसूदन बोल रहा है, sir, slow down the speed, please. Yeah, surely, but this is purely a quick review session, Madhusudan. That is the reason I'm running like a Shatabdi Express. Crispy, crunchy, cursorial review of 178 common, most common in exam. What is the most common symptom of Henoch-Condens purpura? Obviously, it leads to development of purpura. But in case of pediatric population, in case of the patients who have intussusception, Henoch-Collin purpura can be one of the causes of the leading point of the intussusception. Most common cause of hyperparathyroidism होता है parathyroid adenoma. Always hyperparathyroidism presents with hypercalcemia is what you need to remember. Is it okay if I can go at this speed? Because only at this speed I can quickly finish within 1 hour 176 most commons. Okay, so don't worry, this video I don't remove from YouTube. Generally we remove from YouTube. I leave this and you can give a call to our helpline. You are able to see 9000868356 our helpline, right? So be part of our Telegram group and request our helpline for PDF of this set of 176 most commons in general medicine. Okay, so you will get it free. Now, most common symptom of bronchial adenoma. Typically recurrent hemoptysis whenever it is presenting. And you have taken a chest X-ray. Chest X-ray is looking normal. One of the reasons you need to look for is typically inside the bronchi there is an adenoma which is undergoing bleeding. So hemoptysis patient presenting with a normal chest radiograph, you should think of possibility of bronchial adenoma, which is the most common, whose most common symptom is recurrent hemoptysis is what you should remember. Upper GI bleeding most commonly is because of a peptic ulcer. Marfan Syndrome most commonly involves the ascending aorta leading to aortic dilatation, root dilatation. Happens with Marfan Syndrome. Primary biliary cirrhosis. What is the clinical presentation? Mutilated female presenting with pruritus, jaundice, antimitochondrial antibodies positive. That is primary biliary cirrhosis. Accelerated idioventricular rhythm. Where do you see? So how do you recognize accelerated idioventricular rhythm? P wave QRS. P wave QRS. But suddenly P wave and QRS, which is abnormally shaped, which is a ventricular premature complex. So this VPCs, if they become more, that become accelerated idioventricular rhythm. That typically happens whenever there is a myocardial infarction, you have given a thrombolytic agent, you have broken the clot in the coronary, and that led to reperfusion to the myocardium, and that brought a lot of free radicals. Free radicals. They lead to development of a excitability of the conduction tissue, leading to accelerated idioventricular rhythm is what you need to basically remember. So please don't forget, doctor, every day evening we have an excellent teacher, Dr. Ravi Kiran sir. Dr. Ravi Kiran is a top orthopedic surgeon in Visakhapatnam. Very passionate teacher. So in about 40 hours, he will finish 1000 MCQs in orthopedics with a nice review for all of you. Free live online broadcast on onlineMBBS.com. But we will remove that video, we will archive it into incus.online, and you need to buy his course. If you liked the teacher, you feel that his 40 hours video is going to motivate you to read great, then you need to buy subscription to incus.online Dr. Ravi Kiran Sir's orthopedics. Similarly, we have an excellent teacher, Dr. Pushpa. Dr. Pushpa is a topper in foreign medical graduate exam. And she says, what's the fun in preparing for entrance exam and cracking it? If I want, I can get it. But my passion lies with teaching students, making them become toppers. Sir, can I be able to teach on your platform? I said, why not, Dr. Pushpa? Please welcome. I'm so proud that you took mentoring, teaching, and creating handwritten notes, etc., etc. So Dr. Pushpa is also going to teach anatomy. But all these sessions are free, live broadcasted on YouTube channel. No worries at all. But for you to do the revision, you need to go and buy the subscription on incus.online. So I'm going to bring around a dream team of 150 best motivated teachers, 150 medical teachers handpicked across the country after doing a lot of screening of different teachers. And they are going to do a lot of free live online broadcast on the youtube.com/online MBBS. So please click on the bell sign, become a subscriber, so that every time we are starting the session, you get a shootout. Also become part of our WhatsApp study groups and Telegram group, so that before we start the session, we will drop a line for you. Of course, in spite of so many teachers, I am there every day to spend a couple of hours with all of you, because without meeting you all guys, without teaching, without sharing the knowledge, without spending that combined study time with you guys, what is our life? It's not worth living, right? So thank you all for giving your time and joining this session, doctor. Now, the most common fibrinolytic used in India is, of course, this is a little old answer, but streptokinase still scores high. The most common cause of shock in MI, obviously MI will kill the ventricular muscle, leading to cardiogenic shock with a low ejection fraction. Thrombosis is most commonly associated with which site in the venous system? Femoral veins. Thrombosis is most commonly associated. The most common cause of tricuspid regurgitation. Why does it happen? So typically in intravenous drug abusers, veins drain into right atrium, into right ventricle. So there are vegetations on the right side of the heart that lead to development of tricuspid regurgitation is what you need to remember. The most common infection in patients with prosthetic valve, whenever osteomyelitis or endocarditis, staphylococcus is in the options, that is the answer. There is no second answer. That's what you need to remember. Pulsus Paradoxus, most commonly between tamponade versus pericarditis. Tamponade is most commonly associated. Unilateral pedal edema, commonly because of the venous insufficiency, you get a unilateral pedal edema. In MI, ventricular fibrillation is the most common cause of sudden death. The most common mechanism of arrhythmia any given day is re-entry. Re-entry tachycardias is what you need to basically remember. Now, the most common arrhythmia after sinus tachycardia in an ICU patient is atrial flutter. In infants, what is the most common cause of the heart block? Typically, any surgery done for congenital heart disease is the most common cause. Acquired cause of the complete heart block in children is basically a cardiac surgery. The most common cause of cor pulmonale is, if COPD is there in the options, the presence of right ventricular failure, not because of the problem in the heart, but because of the problem of high pressure and pulmonary hypertension, is called cor pulmonale. That is COPD. Coarctation of the aorta most commonly is associated with bicuspid aortic valve. A lot of patients remain asymptomatic for a long period of time with a bicuspid aortic valve. The most common cause of hypernatremia, always remember, hypernatremia is synonymous with dehydration. Hyponatremia is synonymous with edema. So that is the reason you should think of renal losses. The most common neuropathy in diabetes, just before we discussed distal symmetric neuropathy, in the stock and glove pattern, is what you need to remember. Candida is the most common oral infection in diabetes mellitus. Parathyroid adenoma, most common cause of hyperparathyroidism. In men 1, what is the most common endocrine tumor? It is the gastrinoma, most common endocrine tumor in men 1. Then, once more, this is such a repeatedly asked question. Most common, men 1. Most common, men 1. You should only think of gastrinoma, nothing else. The most common cause of malignant adrenal mass. Generally, adrenal, it is the metastasis, is the most underlying cause for a adrenal mass, which is malignant, is what you should remember. Marfan syndrome is primary hyperaldosteronism, which is often associated with adrenocortical adenoma. Typically, non-cirrhotic portal hypertension. It's called non-cirrhotic portal hypertension. What is the most common presenting feature? They present with the upper gastrointestinal bleeding is the most common cause in non-cirrhotic portal hypertension. A 12-year-old girl with tremors, neurologist has seen. Emotional lability, psychiatrist has seen. Golden brown discoloration in Descemet's membrane. Finally, ophthalmologist has seen. The diagnosis is Wilson's, is what you should remember. In Crohn's, what is most commonly involved? It is the terminal ileum, most commonly in case of the Crohn's. Ulcerative colitis, it is the rectum which is most commonly involved in ulcerative colitis. Of all the various patterns of Mendelian inheritance, it is the autosomal dominant which is the most common pattern. Autosomal dominant disorders are asymptomatic in childhood, right? So, structural protein disorders are all autosomal dominant. Symptomatic in childhood and rate limiting enzyme associated genetic disorders are all autosomal recessive. Once more, you need to go back to onlinembbs.com video library, doctor, and need to do a revision on a topic called inheritance pattern in pathology folder in onlinembbs.com video library. Yeah, you'll promise me that you will do that revision. Give me 1 minute, I'll just get some water. Now, heavy chain diseases. This is one of the favorite questions. Of all the heavy chain diseases, which is the most common type, there's a Franklin, Seligman, New Chain, etc. You need to, I don't go into detail, my job is only to charge you to identify the pattern of questions in the NEET, PG, AIIMS, etc. in this session. so that you go back to the onlineMBBS.com video library and do the revision. That's the whole idea. The most common carcinoma associated with rheumatoid arthritis. Rheumatoid arthritis, lymphoma go together when it is a Sjogren syndrome. So it is a large granular lymphocytic leukemia. The most common inherited bleeding disorder. A lot of people do this question wrong. They will think hemophilia. No, it is the von Willebrand disease. Always remember, doctor, a girl presenting with menorrhagia, increased bleeding. If this is the question of the examiner, it can't be explained. And you should only think of von Willebrand. A boy presenting with hemarthrosis and bleeding diathesis. Then you should think of hemophilia, is what you should remember. Okay? Now look. Mycosis Fungoides. Typically, you see Potrier's microabscess. It is the most common type of a cutaneous lymphoma. It can lead to erythroderma, and it can spread into circulation, peripheral circulation, the tumor cells. It is not indolent, it is very aggressive and very refractory to the treatment. That's what you should remember. Of all, what is the most common blood transfusion reaction? A febrile non-hemolytic reaction is the most common. In beta thalassemia, intron 1 inversion is most common. In myelodysplastic syndromes, what is the most common age group? Most of the myelodysplastic syndromes are the precursor for a myeloid leukemia. So they are more common above the age of 50. In an immunosuppressive therapy taking individual, what is the most common malignancy? Typically cutaneous tumors like skin tumors. They are most common. The most common pulmonary manifestation of AIDS any day is pneumonia. In AIDS patient, if he presents with seizures, you should always look and think about a space-occupying lesion like toxoplasmosis is what you should remember. The most common cause of buckets and buckets and buckets of diarrhea in AIDS patients is Cryptosporidium. You should not forget what is the drug of choice also. But I will not tell now because I want you to subscribe to the onlineMBBS.com video library and do a revision on HIV. And in microbiology, what is the drug of choice for each of these various parasitic infections? We have discussed it in great detail. The most common cause of pleural effusion in AIDS patients. Kaposi sarcoma. Extrapulmonary TB most commonly involves lymph nodes, tubercular lymphadenitis. Unilateral hilar lymphadenopathy commonly is because of the TB. Bilaterally sarcoidosis, unilaterally is TB. The most neurological disorder in chronic renal failure patients, presence of peripheral neuropathy is the most common neurological disorder. The most common acute complication when a patient comes out of dialysis, you should be watchful about is hypotension. So all complications of the dialysis like dialysis disequilibrium syndrome, etc., everything you should be good with, doctor. So dialysis is hypotension. Renal vein thrombosis. Commonly it is the membranous glomerulopathy, the most common cause that presents with renal vein thrombosis. Nephrotic range proteinuria in the adult, most commonly due to the diabetes leading to diabetic nephropathy is what you need to remember. Very important question. There can be retinopathy without nephropathy, but nephropathy always exists with retinopathy. That is an important principle you should not forget. Retinopathy can occur without nephropathy, but nephropathy always happens with retinopathy. is what you need to remember. What are the most common location of hypertensive hemorrhage? Putamen, external capsule. Putamen and external capsule. Now, otherwise, examiner will also ask you, other way, basal ganglia. Putamen and all. So you have a thalamic bleeds, ganglionic bleeds. Thalamic bleeds are oblong, horizontally. Ganglion bleeds are more typically thalamic bleeds are more oblong. Internal capsular bleeds are more vertically oblong. That's the point. Now, doctor, the most common cause of an embolic stroke, typically atrial fibrillation. That's the reason you should know based upon the risk factors. Whenever atrial fibrillation is there, you have to start the patient on anticoagulation immediately, otherwise your patient is landing in embolic stroke. The most common site of cerebral infarction, commonly MCA strokes are most common, that's all. Subdural empyema, pus collection underneath the dura, is due to Streptococcus pneumoniae. While Staphylococcus is more virulent, leading to osteomyelitis, endocarditis, its counterpart Streptococcus is more indolent, leading to subdural empyema. Lambert-Eaton myasthenic syndrome. Typically, there is an incremental response to repeated electrical stimulation. Once more, you should know all differences between myasthenia gravis, Eaton, Lambert. At least one difference I will tell before I go to the next question. How is the deep tendon reflexes? Favorite question of the examiner. Typically, if you take the myasthenia gravis is involving the nerve forms a synapse. There are voltage-gated channels in the synapse. There is calcium voltage-gated channels. And they cause the release of the acetylcholine, which acts on the postsynaptic membrane. So, the nerve up to presynaptic membrane is part of element. Postsynaptic membrane is not a part of element. That's the reason myasthenia gravis will have a normal deep tendon reflexes. Whereas Eaton-Lambert is involving the presynaptic membrane, which is as good as the nerve, which is an element. That is the reason decreased deep tendon reflexes is a feature of Eaton-Lambert syndrome, is what you have to emphatically remember. Intracranial aneurysm. Trochlear is most commonly involved because trochlear has the longest course in the calvarium. That's the reason it is the most common nerve involved in the intracranial aneurysm. The most common cause of subarachnoid hemorrhage is Biliary aneurysm. And the most common etiological factor predisposing to the subarachnoid hemorrhage is hypertension. And Biliary aneurysms are most common in anterior circulation of the brain. And the rupture of the Biliary aneurysm leads to the development of subarachnoid hemorrhage. So whenever you do an ileal resection and create a short bowel, which vitamin is most commonly become deficient? It is the cyanocobalamin, vitamin B12. Absorption is most commonly impaired, is what you need to remember. So short bowel syndrome typically lead to development of vitamin B12 deficiency. Nosocomial pneumonia. Nosocomial pneumonia is most commonly associated with gram-negative bacilli, is what you should remember. Now, doctor, empyema thoracis is most commonly caused by Streptococcus pneumoniae. You'll remember me in exam hall tomorrow. Definitely 5 to 6 questions सीधा आज अभी हम जो डिस्कशन कर रहे हैं मोस्ट कॉमन्स का 5 to 6 क्वेश्चन सीधा इस लिस्ट से नहीं आए तो मैं मुरली भरद्वाज नहीं हूं, ठीक है? So that's the reason, take every opportunity to get yourself, get that shining edge of a sword. तलवार के तार के जैसे आप चमकना चाहिए जब एग्जाम को जाते हैं, and you have to cut the head of the competition like a great warrior fighting an epic war. That should be the spirit when you go for the NEET PG exam, doctor. If you are Dr. Murali Bharadwaz, students, classmates, study mates, right? Now, for the past 20 years, almost 2 lakh medical students, 200,000 medical students I have seen. So, one of the biggest challenges while we are preparing is, आज करेगा कल, कल करेगा परसों, परसों का बरसों. That is the syndrome, reverse Kabir syndrome, keep happening among the medical students. That's the only reason people lose the seat. Perseverance without a break. Perseverance is the name of the game called as NEET PG, FMGE. Every day, study 2 hours with me. Another couple of hours, review the video lectures on the onlinemmbbs.com video library. Every Sunday, take grand test. Every day, take 100 MCQ section test on the Q scanner. If you don't get seat, 6 months if you walk along with me, if you don't get the seat, mera jimmedari. Okay? So let us work together. Most common cause of the lobar consolidation kya hota hai? Streptococcus. Most common cause of the lung abscess, often it is the anaerobes in the mouth. That's the reason one of the important nursing intervention, make the patient clean his mouth twice a day, if required thrice a day, especially elderly who are vulnerable for the lung abscesses. Most common pattern of pneumonia is seen in Klebsiella. Klebsiella lead to lobar pneumonia, and whenever it leads to lobar pneumonia, there will be fluid collecting between the 2 lobes into the fissure. That's called bulging fissure sign, is what you see with Klebsiella, is what you need to remember. In sarcoidosis, lung is most commonly involved. And what is the cause of sudden death in sarcoidosis? Arrhythmias. Always sudden death means think of only arrhythmias. A patient has secondaries to the adrenal. What is the most common site of the primary that goes to adrenal? It is the lung carcinoma that goes to adrenal. That's the reason whenever a patient is having lung carcinoma, whenever you are advising a CT scan, you tell your friend, a radiology friend, भैया लंग के लिए कर रहे हैं ना, जरा एड्रिनल का भी कट्स दे दो. Please do a free cut, screening cut, to check for the adrenal mets. Adrenal mets are most commonly primary, comes from the lungs, is what you need to remember. A 60-year-old male presented to the emergency with breathlessness, facial swelling, dilated veins on the chest wall. What are the most common cause? Superior venocaval obstruction. Whenever SVC obstruction is there, what are the 2 common causes for the SVC obstruction, doctor? One is lymphoma, other is bronchogenic carcinoma involving the apex of the lung, which is called Pankos tumor. But if it is lymphoma, if you give steroid, lymphoma melts like snow. Steroid melts lymphoma like snow. If the SVC patient came with dyspnea, you have given steroid, by next day morning when you come to the rounds, patient absolutely dyspnea gone and relieved. He will say, thank you, doctor. But if that SVC obstruction were to be due to the lung carcinoma, you can't help really. You need to put a stent into the vein, superior vena cava, in order to let the drainage, right? Otherwise, patient will succumb. So, tomorrow as an interventional radiologist, you need to put a stent into the SVC whenever the obstruction is because of a compression from the apical pancreas tumor, is what you need to remember. Now, most commonly, superior vena cava syndrome, which type of carcinoma? It is the small cell carcinoma. Now, non-small cell, that is squamous cell carcinoma, typically, it is the most common non-small cell carcinoma, squamous cell. Single agent chemotherapy is a preferred therapy for patients who are more than 70 years with a advanced disease. Contralateral mediastinal lymph nodes, if they are involved, then that becomes a contraindication for you to do. Surgical resection is what you need to remember. Takayasu, that type 1, type 2, type 3 of all, type 3 is most common. Once more, I don't go into details. We already discussed this in the onlinembbs.com video library in the topic of vasculitis. Please take an opportunity to do the revision. Carcinoid, most common, appendix. Infective endocarditis because of the pseudomonas is a very common finding in intravenous drug abusers. The most common extrarenal involvement in ADPKD. This is a slightly controversial question once more. Most comments are all like that. Different studies with different answers. Just I leave this for you to check the answer, right? I'm not committing on any. Now, what are the most common central nervous system parasitic infection? Everyday seizures, Neurocystic cirrhosis. Most common site of metastatic disease, typically liver is in the crossroads between the gut. Similarly, heart, from the liver to heart, from the gut to the liver, and the entire circulation, at least one pass should happen through the liver. Definitely, the liver is the most common site of the metastatic disease. The most common type of pituitary adenoma hota hai prolactinoma. Reactive arthritis. He can't see uveitis. He can't pee because of urethritis. He can't climb because of arthritis. So what is it because of? Chlamydia is the most common infection, UTI, that precedes a reactive arthritis. Earlier days, before penicillin, gonococcus used to be most common. But nowadays, with antibiotic era, chlamydia. Which cranial nerve most commonly involved in sarcoidosis? Seventh cranial nerve. Spinocerebellar ataxia. I always hated this topic. Even in MD, people talk metaphysical aspects in neurology. Discuss, debate, discharge patient with multivitamin telling him, Bhaiya, I cannot help you. That is neurology. So, SCA type 1 is most common form of spinocerebellar ataxia. The most common side effect of the chemotherapy. Nausea. Sometimes, even you say a word, chemotherapy, before a cancer patient, he will puke on your face. So be careful. That much nausea it will be, right? Now, the most common location of intracranial neurocysticercosis. It can happen in spinal cord, it can happen in orbit, but brain parenchyma is the most common. Histiocytosis most commonly involves the bone. The most catheter-induced blood infection is staphylococci, but coagulase negative staphylococci. Progressive multifocal leukoencephalopathy. Very good. Dhanalakshmi, Vinay Botra, and many more who are all online. Keep punching the answers, doctor. Make this an interactive session, right? So please subscribe to the YouTube channel. And tomorrow evening, Dr. Ravi Kiran, one of the excellent orthopedic surgeons, is going to deliver the sessions. And Dr. Pushpa is going to teach anatomy. And we also got a very good physician, Dr. Damayanti from Mumbai. She said, I love to teach for the PG entrance aspirants. So I'm creating 250 dream team of wonderful teachers who wanted to create the courses and stream free live broadcast onto the onlinembbs.com YouTube channel. So inform your friends to join this revolution in medical education. Progressive multifocal leukoencephalopathy. Patient presents with visual disturbances, speech disturbances, commonly seen in immunocompromised patients. And often it is an indolent course, and patient usually dies within 6 months if he has got a poor prognosis, is what you need to remember. Mycosis Fungoides. Typically, there's a portreal microabscess, most common form of cutaneous lymphoma, and erythroderma. Please don't forget these buzzwords. Most common type of glial tumor. Always glioma, astrocytoma go together. So astrocytoma. Most common fungal infection whenever there is a febrile neutropenia. This is another hot topic for the examiner doctor. You should know all diagnostic criteria for the febrile neutropenia. You have to be very sure. So it is Candida. Asbestosis typically involves the lower lobe. Silicosis involves the upper lobe. That is the whole difference. How will you remember? Silicosis. Silica means your sand. Sand is earth down, but it involves upper lobe. Asbestos, you will put a roof, but it will involve lower lobe. Don't tell Murali Bharadwaz teach like this. Anti-centromere antibodies, Crest syndrome. Biliary most commonly is with hepatic vein obstruction. A good number of times because of a web. Hypergonadotropic hypogonadism. Matlab, testosterone is low, but FSH, LH is high. That typically happens in Klinefelter because in Klinefelter there is seminiferous tubules become hyalinized. Hyalinized seminiferous tubules are there. So the whole factory of testosterone production of testis got affected. If testosterone is not there, there is no inhibition on the FSH and LH. That's the reason FSH elevates, LH elevates is what you need to remember. Anterior mediastinum thymoma is the most common tumor. Sickle cell disease. Patient requires frequent blood transfusions. Acute infection is the most common cause of mortality before 3 years. And sickle hemoglobin polymerization, they have got a very positive correlation. But before 6 months, there is predominantly fetal hemoglobin. Fetal hemoglobin does not have a beta chain. The whole sickle problem is in the beta chain. So that is the reason, because hemoglobin F is a predominant hemoglobin in the early part of the life, they don't have any clinical manifestations in the first 6 months. The most common accessory pathway leading to WPW syndrome typically is originating from the left free wall. Diffuse axonal injuries typically occur most commonly between gray and white matter junction. It is caused by a shearing force. There will be a lot of white matter hemorrhages, basal ganglia, and corpus callosum typically are involved. The most common trisomy is Downs, 21. Raynaud's phenomena. It is more common in females. Most common cause of Raynaud's phenomena is Raynaud's disease. It has got a good prognosis. Most common CNS manifestation, whenever there is any Whipple's disease caused by Porphyrema whippleyi, it presents with dementia, which is the most common CNS manifestation. So, doctor, you are now the champions of 174 most commons in general medicine for the NEET PG, AIIMS, PGI, and FMGE. Similarly, if you take all 19 subjects, there are almost 3,000 most commons you should be very good with. Similarly, we will also take a session similar to this, investigation of choices. What are all the questions asked on investigation of choice in each of the subjects? Like that, now we are using some data analysis algorithms, trying to classify the data into interesting subsets and categories which are frequently asked in the entrance exam, and we are going to have a quick debate on all this. But let me tell you, doctor, it is very difficult to remember this kind of lists, but still I discussed them because I want you to get that required inspiration and energy and petrol, right? To go back to the onlinembbs.com video library and do the revision. Enjoy a great time. Many more broadcasts with many more teachers shortly coming up. Be tuned. Have a great preparation for the upcoming exam. Thank you.